Hi there, I'm Dr. Paul Dillon and one of the co-founders of the Review Course in Family Medicine.
My name is Dr. Simon Moore, and at the Review Course for the last 6 years now, we've trained thousands of residents and practice-eligible candidates how to succeed on the CCFP exam.
Every year, residents and trainees ask us the same questions again and again. We tell them to go to the CFPC website and the answers weren't there. So what did we do?
We asked the CFPC. So let's take a look at these top questions without any further delay and dive right in and find out the real answers that the CCFP sent us.
So which drugs are we expected to know the doses of?
So there was like 4,500 drugs that we needed to know doses of?
All of them.
All of the drugs?
No. So the answer we got and what we've been teaching at the Review Course is you've got to know emergency drugs. Drugs where there's a safety imperative, where you need to know the doses, there's no time to look it up. So drugs such as epinephrine.
The next question we asked them was, is oxygen considered a drug on the exam? Because we dose it, there are side effects if it's done improperly. People buy it illegally, right? All these things.
I get my oxygen every day from a guy I know on the street.
There you go. See, it's got all the features of a drug. So if the question says, is it a drug or which drug do you give? Can we write oxygen?
So the answer is no. So for the purposes of the exam, oxygen is not considered a drug. It's considered a treatment. This is similar to IV fluids. On the exam, IV fluids are a treatment. So if the question says treatment, then you're thinking oxygen or IV fluids as a part of that rubric.
Now, I know what you're thinking. You're like, Paul, why are you being so pedantic and ridiculously particular? But the point is, number one, it's not Paul, it's the CFPC. And number two, this is the level of detail you need to be reading the questions when you're in the exam room.
So at the course, we reify this, we say it again and again, and we teach you tips and tricks to make sure you don't make those small mistakes on the exam.
Another question that we got, are partial marks given? When people just grasping for hope, grasping for straws, do we get a third of a mark for this answer?
The answer, once again, is no. There's no partial marks given. And if an answer is, oh, you think this is close, I'll write it down, they're not going to give partial marks for that either. It's either right or wrong, and it's one answer per line. So no partial marks for a single line.
No mercy. Just no heart, no soul, no mercy from the CFPC on this one.
So this next question, is the at-home interface with ProProctor the same as the in-person exam? What's your advice to people?
We have two answers for this. So there's the official answer and then what we've seen in real life on our Facebook group where people discuss their experiences with the exam. So what was the official answer?
So the official answer, it's the same. Period.
But we've spoken to some exam candidates who said, I've done it in both places. I've done it in person. I've done it at home. And maybe it's the configuration of the computer or the software. For some reason, it did show up differently. They had trouble with displaying, zooming, highlighting. So what's your advice to folks to prepare?
Download and practice at home. Bottom line, you've got to do it and do it early because then you have time to troubleshoot.
The next question we get is, should I write X-ray, PA, and lateral on one line? Or is that a separate investigation? You said one answer per line. So is this two answers or one?
They were so specific, saying one answer per line. And to me, it's like, that's a different view. But so we emailed them, took a couple of years, but we got the reply. So that is the same. So X-ray, PA, and lateral, different views of the same investigation. That's one answer per line. Ultrasound would be on a different line, but X-ray, PA, and lateral. Oh, did I give it? I left a naked
Never say
ultrasound.
It's a naked ultrasound. That's unethical, vulgar, and disgusting. That's the reaction you should have if you ever hear someone say CT. Or ultrasound. Yeah,
it's got to be really specific. So fill up that line with up to like 10 words. CT of the abdomen with contrast. Is it PO or is it IV? So no naked CTs, no naked ultrasounds, and X-ray, PA, and lateral can be on one line.
The next question, can I write vital signs as an answer? Can I?
Often asked. The answer is NO. So no, you cannot. It is not specific enough. Similar to CBC. Can't write it on the exam. Can't write vital signs. You have to write down which vital sign you're looking for.
And there's a specific list. We'll show you how to access the list of things that you simply cannot write on the exam, such as CBC, electrolyte, LFTs, lipid panels. We use these every day on the wards, but you can't write that on the exam.
Do I have to calculate Wells score, Framingham risk score? Do you have to memorize all those calculators you look up on your phone at the point of care? Simon, do I have to?
Well, you'd be a terrible doctor if you can't remember the Framingham score and how to calculate it, can't you? There's a whole chart and table, isn't there? You don't know that?
I don't have it memorized in my real life practice, but for the exam, what's the answer that they gave us in their frequently asked questions? So they say you should know and have a decent knowledge of them. So they don't come out and say you have to memorize it and calculate it, but from what it sounds like, they're saying you need to be able to know the different parts and figure out whether the patient is going to be low, medium, high risk using the score. So essentially, if it's a common score, you got to have a pretty good knowledge of it.
And it's really helpful because you're actually studying two things at once. You're studying risk factors for this condition while you're studying the score. So in the answer from the CFPC, between the lines, they're practically saying, study these things.
So it's a great way to study when you're on the wards.
Yep, it's essential, I would say. In fact, why don't we talk about some of the exam essentials? This is where we've curated over the last several years all the resources that you need in order to prepare. Do not try and write the exam without taking a look at this page.
And I think take a look at it really early. We've kind of broken it down into here's the stuff you need to know as you're getting prepared as an R1 to write the exam. What are the resources? We have a list of peer-reviewed resources. So much information. It's a great place. Bookmark it. You'll come back again and again.
Yeah, we've conducted research onto what the best tools are. It's all there, available free of charge. The other things that we've done is we've compiled multiple really, really useful tools and resources. We create a list of exam tricks, tips, and habits, and we go into great detail. This is just one example, one preview of the many, many pages of exam tricks, tips, and habits that we teach at the review course in family medicine. We've taught across the country and had thousands of successful candidates.
So we hope that's helpful, and we hope to see you in person in 2022.